What is stopping you from taking care of your life? Many people want to practice what we call self-care, but there are hidden barriers. Sometimes the barriers are ourselves, sometimes the barriers are outside. Welcome to Mental Health and Science with Beloved Enoch Francis. Today we want to talk about the barriers to self-care. Okay, so if you are still new to our channel, we request you to subscribe because this motivates us to create more content for you. So one of the barriers to self-care is that I don't have time. Okay, I don't have time to care for myself. I don't feel like I should. Okay, these are the things that are hindering us from taking good care of ourselves. Okay, feelings of shame, like you feel like it is a shame to tell people that you have problems, that you cannot handle these problems. These are some of the things that are hindering us from taking care of. So you feel ashamed that if you tell someone your problem, you feel that they may think that you cannot handle that kind of problem. We are saying that is not good for you. Okay? Having that feeling you are afraid, like what people will think about you, that now I cannot handle such a task. I cannot handle this. So that one has hindered very many from practicing what we call self-care. I don't want to burden others. I don't want to burden my friends. I don't want to burden my family members. Okay? So we are saying that during self-care, that if you feel like there are certain things that where you need help, please go to your friends, ask them that you people, I want to do these things, but I don't know how to do it. And they will support you. Other than pretending that you know what you are doing, but inside you, you know very well you cannot perform it. So seek for support from others. Don't say, are you a burden to others? Okay? Then there are people who also have a belief that no one can understand or care. So if you have such feelings which are hindering you from taking good care of yourself, like you said, nobody can understand me, nobody can care for me, even if I tell them, no one will help. That feeling, you need to remove it out of you, and you need to start practicing what we call self-care. Then also, feeling defeated at work is another barrier for us to do what we call self-care. You feel like, there's nothing I can do here to improve my life. There's nothing I can do to add on. You feel your work, the work you are doing, it does not add value. So this is a barrier to self-care. Okay? So if you are still new to our channel, I request you to subscribe because this motivates us to create more content for you. We are welcoming people who can support what we are doing. For example, the mental health awareness, the mental health outreaches, okay, here in Tororo and also in Ashivale. So if you are that person who is interested in supporting mental health, please, you are welcome. My contacts are just there. My purpose as a psychiatric clinical officer or as a mental health profession is to assess people whom we think or suspect to be having mental illness and to diagnose them correctly according to the international guidelines, and also to manage them with the right medication and also the psychotherapy. So that is the work that we do. So if you are really interested in the mental health, we request that you can come and join us. You welcome. You may be an individual, you may be an organization. We request you to come and partner with us. Okay? Then another thing we are saying, that lack of consistent supervision. We have said that sometimes when our people are not supervising us, okay, we may not discover that we need to go off our duties. We need to go have a break. So if you're a supervisor, we have talked about that you need to supervise the people that you are under you, so that you can identify that this person is struggling in this area, needs to go for a holiday, needs to go to take an off. So lack of supervision is one of the barriers to self-care. Then also another one is having difficulty setting limits. This is one of the areas that I have a problem. During my time in Achieva Refugee Settlement, even here, my goal was to, every time I go to see patients, I want to ensure that I clear the line. Whether there are over 50 patients, I feel I should clear each and every one. And I ensure that I have written for them By the time reaches where you reach a point where your brain is overtired, you cannot think anymore. So we are saying that having time to set boundaries or limits is another hindrance for us to do what we call self-care. Then another thing is blaming others or self. Okay, so if you start blaming others or yourself, that is another barrier for self-care, because you are not realizing where the problem is coming from. Then also having a negative attitude. For example, I cannot do this. I cannot do this. Like you cannot manage to carry out the self-care is one of the things. We said self-care, these are activities that we can do on daily basis to overcome stress and also to improve our mental well-being and also our general well-being. Okay, then lastly, we are going to talk about feeling of powerless, of changing things with clients and also in the community. So you may have feelings that you are powerless, you cannot make any other improvement in whatever you are trying to do, maybe at a workplace. Even if I'm not there or I'm there, I don't see anything that I can add value here. So you feel you are powerless. So this is an hindrance or a barrier to self-care. Okay, so if this series has been interesting for you about self-care, please subscribe to our YouTube channel, and we are welcoming individuals, organizations, and any other person who is interested in mental health. That please, you can partner with us, support our mental health outreaches, support our mental health awareness programs. Okay, my contact is just there. You can get in touch with me. If you feel this information, what we are sharing is important, please, you are welcome to join us. We want to continue with these messages on radios in our communities here in Tororo and also in Nachi Valley refugee settlements. Please, we welcome you. Thank you so much. Let me see you in our next video.